Hello and welcome. I'm Alex Messier, licensed massage therapist and certified personal trainer. Today I'm going to show you guys a few basic exercises, stretches, and mobilizations that you can use when dealing with a diagnosed meniscus tear. Now, I do not diagnose any injuries, that's out of my scope of practice, but if you have already gone to the doctor and received a diagnosis and are contemplating surgery or possibly PT, well, I'm going to offer you a few solutions that you can try. I personally have dealt with a meniscus tear twice, two separate times. So I've been through the ringer and I know some exercises, and it's truthfully what has pushed me into this path of being passionately attached to it. So here we are today. For demonstration purposes, my left leg is going to be the affected area. Hope I'm in frame here. Okay. So, first exercise we're going to do is more of a stretch. So I'm going to take that affected leg and slide it up, keeping my heel flat on the ground the whole time, bring it up as close to my butt as I can, and then return, extending it out. We're going to do this for about 20 repetitions. Again, sliding with the sliding with the heel flat on the ground the whole time. The goal of this exercise is kind of a little bit of a warm-up. Increases the range of motion in the knee, primes it for what we're about to put it through, gets it to release some hyaluronic acid and synovial fluid, which both act as joint lubricants. So we're really just trying to coat that joint, get all the sliding surfaces good on the inside before we move forward with some other exercises. So again, we'll do this 20 times. After we get to 20 times, we're going to move on to the next exercise. Now this exercise, you can place a towel beneath your knee if you'd like, just to kind of have a target, because the goal here is you're going to go from a rested state, relaxed, to trying to push that kneecap into the towel or into the floor, effectively firing the quad in the process. So it looks like this. And you'll hold that contracted position for about 5 seconds and release. Now you can do this in a seated position like I am, or you can lay back and do it. Whatever is more comfortable for you. It doesn't really matter how your other leg is, whatever's comfortable. The whole goal here is just to focus on your affected leg and really trying to contract the quad and drive your knee into the back of the mat. So this one we will also do for 20 seconds, holding a 5-second isometric contraction at the bottom, and then relax. From here, I like to add this little, since we already have the towel here, roll up a small hand towel, place it behind that affected knee, lay back, and just squeeze your leg together, trying to crush that towel. This is just a flexion gapping exercise that actually works on the knee capsule itself rather than the surrounding structures. It's good because if you look at your knee as a hinge, sometimes when you have a really tight hinge over time, hinge dust and rust will accumulate underneath the joint. That's how you usually know when you have a tight hinge, if it's an old rusty door hinge or whatever the case may be. Your knee functions the same way. It only flexes in one direction. So knee is a hinge joint. So this basically does the same thing. It kind of brushes away that dust, knee joint dust if you will. and opens up the knee capsule, giving it a little bit more space for the structures to move around. This one you can do for about 10 repetitions. Hold it 3 to 5 seconds in the contracted state and move on. All right, next we're going to actually do an elevation, isometric elevated contraction with our left affected leg. So you want to bend your opposite leg to a 90-degree angle like I'm doing here. This really just engages your lower back so you don't put extra stress on it. All right, so from here, what you want to do is point the toes straight up into the air and raise the leg. This might look simple, but it's actually pretty tough. I'm actually shaking a little bit myself. Now this exercise you want to do for about 10 to 15 reps, moving slowly in a controlled fashion. This is great for strengthening your quadriceps muscle while moving it in a dynamic fashion. All right, after we finish that, we're going to actually flip over onto our side. Now the important part with this is you want to be completely flat on the side. You don't want to be rolled over your hips this way, because that's cheating and you're going to compromise your low back. You want to be completely over on the side. Everything's stacked. From here, you're just going to raise your affected leg, this being the left leg in this case, up. Again, you want to make sure all of your joints are stacked, so you want your heel and your toes pointed forward. As you can see I'm doing here, you don't want to do this, for example. That's not good. You want it to be straight. This is surprisingly tough for a lot of people because we sit a lot and we've lost a lot of hip function. You'll feel the burn here in usually around this area, your glute med. Helps stabilize your hips. This one, it's going to be tough at first, so I would say anywhere from 5 to 10 repetitions for your first couple times. Slowly build it up each time, of course. All right, from here, you want to take a pillow, fold the pillow over, stuff it between your knees. As you can see here, I'm laying back because it's more comfortable for me. You got your heels both pointing, or your toes pointed forward, as you see is common in all these exercises. You want to have good joint mechanics throughout all exercises. So from here, this position, you're basically just going to squeeze the knees together. Hold for 3 to 5 seconds and release. Squeeze the knees together. Hold and release. Try and get a little different angle here for you guys so you can see what's going on. All right, so I'm relaxed here. Squeeze the knees together. 1, 2, 3, 4, 5. Relax. Squeeze 1, 2, 3, 4, 5. All right, we'll do that exercise about 5 to 10 times as well. All right, so that's the majority of the actual exercise components. From here, you really want to start focusing on now some stretches. I personally use a stretch out strap here, which is nice. It has a bunch of handles and whatnot in it, but if you don't have that, you can always use a dog leash. Here's my dog leash here with the poop bag on the ends, just to demonstrate. So you want to wrap the dog leash or the strap or the belt, whatever you have that's long enough, around the balls of your feet so you can get a good stretch on your lower leg. From here, you're going to grab it, make sure you have a good grip on it, and you're going to lean back. as far as you can get. If you're all the way down here, that's fine too. Now what you really want to focus on in this stretch is engaging that strap to pull your toes backwards, effectively creating a stretch on the back of your gastroc calf muscle, which actually inserts and crosses the knee joint here. It can cause some complications when it gets too much tightness in the back, so you really want to pull your toes back, but you also want to try and lift the band as far backwards as you can to stretch your hamstrings as well. Your hamstrings and your calves muscles both actually cross the knee joint, so they're important muscles to consider when dealing with any kind of knee pain, meniscus pain included. So some people use this as a static stretch and they'll just hold it out here for a little bit of time. Personally, what I find to be a lot more effective is a little contract relaxes, a little bit more advanced technique. You don't have to do it. If you want to go with the static stretches like I was demonstrating earlier and I'm doing right now, you can just hold the stretch for upwards of 30 seconds and then release it. If you want to go to the more advanced version, you can do these PNFs or contract relaxes where you'll have your knee in an engaged state, pulling it this way, and now I'm actually going to try and pull my leg towards the ground with my legs force while I'm resisting it with my arms. And I'll pull it to the ground for about 3 seconds, hard pull, and then I'll relax, and I'll pull past my joints or my muscles' previous range of motion. Do it again, contracting into the ground, and relax, pulling farther. All right, so there you have it. That's some of the most basic exercises and stretches to help with meniscus pain due to a meniscus tear. A lot of times a meniscus actually cannot re-heal itself due to its avascular properties, but if you can alleviate the pain and symptoms associated with the meniscus injury, then a lot of times the surgery isn't necessary. So go through the exercises, do them, slowly progress, meaning longer tempos, more reps, more sets as you go, but focus on quality over quantity. Less reps at first in a good manner trumps just going for repetitions in a dysfunctional manner. Because a lot of times that's what causes the issues in the first place, is moving in a dysfunctional pattern. Now, I gave you specific knee and I gave you specific knee exercises and stretches around the knee joint and a couple muscle areas around it itself. Now, that could be helpful, and hopefully it is, but a lot of times the reason why you have these pains in the first place, especially in the knee joint, is because you have a range of motion limitation in one of the more mobile joints, being the ankle or the hip. It could even be a collapsed arch in your foot, which is that problem downstream manifests itself upstream because the knee basically can only move in this manner. So once you get some torsion, twisting motion on the joints due to your ankle or your hip being too immobile and not allowing them to move the right way, that's usually what causes a knee pain or a tear, ACL, MCL, PCL, meniscus, whatever the case may be. So there could be other problems downstream or upstream, and the only way I can really tell you that is if I work on you one-on-one, which is always an option. So go through the exercises and let me know.